Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about the power of optimism, resilience, and longevity. What is optimism? It's a cognitive bias and a skill. Optimism is often defined as a general belief that good things will happen in the future. Leading experts like Dr. Martin Seligman and Dr. Sue Varma argue it is a skill that can be learned and refined daily. Two key perspectives. Number one, unrealistic optimism or optimism bias, a tendency to believe one is less likely to experience negative events such as divorce or illness, and more likely to experience positive ones than others. While often beneficial for mental health, it can sometimes be unwarranted and unresponsive to counter evidence. Number two, practical learned optimism, a deliberate active skill set that fuses a belief in positive potential with the mastery of behavioral strategies for problem solving and resilience. The interplay of optimism and the brain, optimism and reward, optimism bias and reward related attention bias may mutually reinforce each other. They are thought to recruit a common neural network. Key components of this network include the anterior and posterior cingulate cortex and the amygdala. Impact on well-being. This positive neurocognitive feedback loop has crucial implications for well-being and mental health. Understanding these interactions helps reveal adaptive neural pathways for maintaining mental health. It also provides insight into the development and maintenance of psychological diseases, suggesting targets for more effective treatment. Physical health, the body's resilience, reduced stress. Optimists are better at managing stress, leading to a stronger immune system, lower blood pressure, and reduced heart rate. Improved cardiovascular health. Studies link optimism to lower rates of heart disease and stroke. Faster recovery. Optimists tend to recover from illnesses and injuries more quickly. Better sleep quality. A positive outlook can improve sleep quality, supporting better overall health. Mental health. Enhanced resilience. Optimists are better at coping with challenges and setbacks. Increased happiness. They are more likely to experience positive emotions and overall life satisfaction. Reduced anxiety and depression. Optimism acts as a key protective factor against mood disorders. Improved self-esteem. A positive outlook naturally boosts self-confidence and self-worth. Increased longevity. Evidence suggests optimists may live longer due to healthier lifestyle choices and a robust mental outlook. The core concept in Martin Seligman's learned optimism is the explanatory style, the habitual way a person explains the causes of bad events in their life. This style differentiates optimists from pessimists across three critical dimensions. Number one, permanence. Pessimists view bad events as lasting forever. I'm always unlucky. An optimist views bad events as temporary. That was just a fluke. Number two, pervasiveness. A pessimist believes bad events will undermine everything. Since I failed this, I'll fail at everything. An optimist believes bad events are specific to the situation. I didn't study enough for that subject. Number three, personalization. A pessimist believes bad events are their fault. It's all my fault. An optimist believes bad events are due to external factors. The circumstances were against me. The goal is to train the mind to adopt the optimistic explanatory style to avoid learned helplessness and cultivate learned optimism. Recommendation number one, actively dispute negative thoughts. The ABCDE method from cognitive behavioral therapy. This is the practical roadmap roadmap to dispute pessimistic thinking. A. Adversity, the event or setback, for example, a failed project. B. Belief, the automatic pessimistic interpretation. I'm incompetent and will never succeed at anything. C. Consequence, the feeling or action that results, for instance, giving up or feeling depressed. D. Disputation, actively argue with the pessimistic belief. Challenge the permanence, pervasiveness, and personalization. I failed this project, not my entire career. I was under-resourced, which is an external factor. Energization, the positive emotional and behavioral consequence that results from a successful dispute. Relentless optimism strategy, reframe failure as a lie. Limited, failure is temporary, not permanent. Isolated, failure is confined to one specific area, not pervasive. External, failure is often due to external or circumstantial factors, not solely a personal flaw. Recommendation 2. Adopt the 8 pillars of practical optimism. Dr. Sue Varma's framework emphasizes optimism as an actionable skill set, the 8 Ps. Purpose, find or create meaning in life and work. Processing emotions, effectively manage emotions. Name it, tame it, claim it, and reframe it. Problem solving, develop resourceful and realistic strategies for challenges. Pride, cultivate self-acceptance and a strong sense of self-worth. Proficiency, focus on a growth mindset and continuous learning and skill mastery. Present, practice mindfulness and engage fully with the current moment. People, nurture strong, meaningful social connections and relationships. Practicing healthy habits. Adopt beneficial routines for physical and mental well-being. Diet, movement, rest. Recommendation number 3, cultivate an internal and external shield. Internal, shift, the subtle art. Optimism is a deliberate and mindful practice, not a loud or aggressive pursuit. Focus on the transformation of your inner narrative and perspective to create lasting psychological change. Treat optimism as a skill to be quiet and persistently developed through small daily habits and self-reflection. External shield, controlling the environment. Limit exposure to pessimistic media and news that promotes pervasive negativity. Avoid over-critical, cynical, or unsupportive people where possible. Actively seek out and engage with people and environments that reinforce a positive, growth-orientated mindset. Recommendation 4, practice visualization and commitment. Mental rehearsal and visualization. Regularly visualize successful outcomes and desired goals. Mentally rehearse how to respond positively and resourcefully to potential challenges, not by ignoring them, but by planning an optimistic recovery. Commitment over complacency. Optimism is a skill that requires discipline and commitment, not just repeating feel-good phrases. It is a constant daily practice, a commitment to positive thinking as a lifelong habit. This deep commitment is the key to unlocking fulfillment in all areas of life. In summary, optimism is not a passive wish. It's an active skill. It is achievable for anyone and provides a pathway to boost health, happiness, resilience, success, and longevity. Recognize your explanatory style and actively dispute pessimistic thoughts. Integrate the 8 pillars of practical optimism into your daily life. Mindfully cultivate your inner narrative and manage your external influences. Start today by applying the disputation D-step to one negative thought you have. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel.